So if you still get confused whenever you hear about PCOS, draw your chest closer. Let us talk about it now. PCOS stands for polycystic ovarian syndrome. It happens when your ovaries starts to release excess androgens. These androgens are male hormones, and because of that, they are now fluctuating the activities of other reproductive hormones and start causing things like irregular menstrual cycle. Sometimes your period comes late, sometimes it flows longer than it used to, sometimes it doesn't even come at all, and you start finding it difficult to predict your ovulation. There is something called follicle stimulating hormone. Its function is to work on the follicles in your ovaries to grow and mature eggs in readiness for ovulation. So on the ovulation day, these follicles will rupture to release those mature eggs. But in this case of PCOS, the follicles will now trap the fluid they contain and the immature eggs. So ovulation does not happen, which is why polycystic ovarian syndrome is one of the causes of infertility. The cause of PCOS is not known, but there are factors that contribute. Factors like high androgen levels, insulin resistance. When you eat food, there is a particular organ in your body that releases insulin. This insulin will convert that food you ate into energy for your body to use. But if your body starts resisting the effects of the insulin, you will now have excess sugar from the food you ate flowing in your bloodstream. In most cases, this will lead to diabetes. It will trigger your ovaries to release more of those androgens. Another thing is obesity. This will make your body resist insulin the more. When you start noticing that your periods are irregular, there is nothing to be happy about in it, because your menses is your first sign of fertility. Excess hair growth, especially facial hairs, like a man. Almost every woman gets acne, but if it is too much and difficult to treat, darkening of skin tags, this is a sign that you may likely be having polycystic ovarian syndrome. PCOS makes it difficult to get pregnant, but if you have a treatment plan that can help you ovulate, then pregnancy is possible. There is no cure for polycystic ovarian syndrome at the moment, but there are medications to help keep it under control. Aside having a healthy lifestyle, this is where Pregnatab prenatal and pregnancy supplements come in. They contain about 19 vitamins and minerals that your body needs before and during pregnancy. Pregnancy does not start in the bedroom. You prepare your body for it. Pregnatab contains inositol and N-acetylcysteine that helps in regulating your menstrual cycle, increasing the rates of fertilization and implantation, inducing ovulation, improving the quality of your eggs, decreasing the symptoms of polycystic ovarian syndrome, ensuring the growth and maturation of the follicles to avoid the forming cysts in your ovaries. When pregnancy happens, you switch from Pregnatab conception to Pregnatab original that protects your baby against any form of defects and helps in the proper production of red blood cells. Remember, you may actually have polycystic ovarian syndrome without even knowing until you're ready to get pregnant.